Vet's Eye View. My name is Victoria Knight and I am the host. Today we're going to encounter a few patients. So before we head inside to the Center of Animal Health and meet Dr. David Visser, be sure to like and follow our Facebook page and subscribe to our YouTube channel.
I know you get nervous, my friend. It's all right.
No,
There
he
you
did
go.
bite when we had him in here, or I had him in a couple of weeks back.
Uh-huh.
He did when I handed him off to your assistant,
Uh-huh.
and then when they did his labs, they had to muzzle him.
Okay.
So. And that's not his usual
Yes.
behavior.
Things are changing for him.
Something's going on.
Okay.
Yep.
Well, we will, of course, need to be careful with what we do. We want to make sure that we're not getting hurt, but we also want to make sure that we're assuring him as much as possible during the examination. So I may need to use it, and but I want to check his teeth first and see what his gums look like, and that gives me an indication as to how the rest of the exam will go.
Okay.
To feel more calm. There you go.
Oh, that's a great boy.
All right. Let's look at this side.
Okay.
Good boy.
Thank you.
Good job, Gaston.
So he has a lot of tartar buildup on his teeth, and there's no doubt about that.
Good boy.
Not our main reason for being here. Coming up and over is sometimes a little threatening, so I'll come around this way.
Good boy.
Check how things are.
Very good job, Gaston.
There you go. And he could be very good at what he does. He could have good aim, despite our best efforts. It's all right.
Good, handsome boy.
Liz is an expert at calm reassurance.
Good boy.
There we go. Don't you wish you had the big magic eraser that could just make all the anxiety, nervousness go?
Yep.
And even as we just said that, didn't you feel like the nervousness kind of leave you, the tenseness? It does for everybody, and they read us. I'm certain that they have
Good boy.
a way to perceive our energy, and sometimes the nervousness that either you or we would feel, they also perceive that.
Good boy.
Yes.
Very good job, Gaston.
He's got that trick kneecap there, doesn't he?
Yes.
Does it ever cause any sort of issue?
It does not.
This is something I'd like to show on the video as well. The kneecap sits in this groove right here at the end of the femur, then the kneecap, and then the point of the shin bone. So this is where the doctor does that knee-jerk reflex, and the kneecap is supposed to sit right there in that groove, but the kneecap can move off to the side. It's moving side to side here, okay? And that sometimes is like a rope coming out of the pulley, and that makes it a little awkward for them to extend their knee during that time period. But if it's just the rope coming out of the pulley like that, they might shake their leg and get it straightened out again, and everything is fine. But dogs that have the kneecap go back and forth for a long period of time can wear away the cartilage, and that's when it becomes a painful issue, not just a functional issue.
Good job, Gaston.
If there isn't ongoing pain or problems, my personal philosophy is that many small breed dogs can live with this the rest of their life without it being a problem.
So Gaston was the Chihuahua that was just in. What was his symptoms that he was experiencing?
So he had a couple of different things going on. First of all, Chihuahuas as a breed sometimes are big dogs in small dog clothing. And so one of his conditions was that he had a lot of anxiety. And his anxiety condition is causing him to urine mark at home, to be aggressive, to be nervous and panicking. And so it's a complex thing. There isn't if this, then this type of solution for this, but when pets have this, they're really experiencing an anxiety. And so I won't simplify the approach except to say that one of the things that we had already done was use a medication to see if it would help reduce some of his anxiety. That medication didn't work, and that's sometimes how we evaluate whether we continue with one medicine versus trying another one. So we are going to go with a 1-month trial of a different medication to see if that can help make the positive difference for him. And the only way that we know is by asking the question in the form of this medicine: is it well tolerated, and does it work? And if so, then we know that we have an option that can be helpful for him, and we can figure out how to use that ongoing. But he had a couple other issues too.
How would a pet owner know that their pet is experiencing some anxiety?
You know, there are different ways. First of all, if people have 2 dogs at home, they probably know the normal experience of 1 dog, and this is dramatically different. So a comparison is really what it is. Otherwise, it's a comparison to what a dog should be experiencing. If we feel as though some of the behaviors are just unusual, there's pacing, there's marking, there's aggression, behaviors are easy to recognize if we know what a dog should feel like in a comfortable, non-threatening situation. So those are ways in which people can be keyed into something that is different. Not every behavior calls for medication. Many times we can use behavior modification or even environmental modification to have pets feel more comfortable. And there's even non-drug ways in which pets can be kept comfortable too. But for Gaston, he had been down those pathways and we were resorting to needing to use medication to be able to help his situation. And does she spend all of her time indoors?
I want to say 95% of the time.
Okay.
She's
And
supervised outside.
supervised outside, so she's not out of your sight or vision, and she doesn't come in contact with other cats.
Well, just ours.
Your own cats, but not cats outside of your circle. Do your other cats go outside more than her?
Nope, it's all 5 at once, or no, but only 4 go out. My Leo James is a baby.
Okay.
That's a cute name.
Hi, sweetheart. Yeah.
Hi.
And she's 11 years old now, is that right?
Yeah.
It's all right,
Okay.
sweetheart.
I know. Good girl.
So one of the things I notice is that the color of her irises are different in one side versus the other. That left one is a little bit different in its appearance. The discharge is existing in both of these eyes though. I'm going to show the 3rd eyelid by pushing the eye back a little bit. And when you push the eye back a little bit, it brings the 3rd eyelid forward. Let's check out your nose and palpate over your sinuses.
Good girl.
And then we want to check your teeth and see how they're looking. The teeth are looking pretty clean. That's good. Want to check in your throat. There you go.
Good girl.
I wish I could say open up and say ah, but I can't. There we go. It's all right.
You're okay, sweetie.
Yeah. And I'm going to feel that thyroid area just since we're down here right now.
Good girl. Good girl.
I do feel the enlargement there.
Good girl.
Do you recall whether there was a weight change from before?
I'm not sure.
I'll take
It
a look.
was minute.
Okay, that's good. And she is or is not on any thyroid medicine. Okay. I don't diagnose hyperthyroidism just by the feel, but rather that the test shows that it's high. And if it's not, then there is no need for the medication.
That's what I'm wondering, kind of how I knew she wasn't feeling good, because usually she's the type where she's in the room, it's like, you may look up at me, but do not touch me. But she's been like on my lap. I mean, everywhere. I mean, she follows me everywhere, and that is not normal.
Normal temperature for cats is 101 to 102 and a half.
Okay.
We'll see where we are at.
You're okay. I know. Good girl. Good girl. Good
Okay,
girl.
her temperature is normal at 102.
Good girl.
I'm glad about that.
I know.
Where with her smashed in nose, like, how does that affect her breathing,
Not only her breathing, but her susceptibilities. When we created cats with a shorter nose, we really shortened the amount of the filtering that the body would normally do. So we're glad that we have such beauty, but unfortunately it also means that they're a little bit more susceptible to respiratory conditions that they might have filtered out or handled with an increased surface area. With less surface area, then we have more ability for the bacteria or organisms to multiply and cause issues. Now when I talk about bacteria, I don't know what's causing this, but I do know that with the material that appears to be there, there's at least inflammation, and that inflammation could be due to bacteria. It could be that there's a virus that came about.
With Samantha coming in, she's a Siamese cat. What was the issues that she's encountering today?
Samantha had some respiratory and eye signs, and so what people noticed and what the owner noticed at home was that there was a lot of discharge around the eyes, and there was a color change that had occurred in the eyes too. In one of the eyes, it was a little bit different in its appearance than the other one. There are tests that we could do to see whether there's a bigger internal eye issue. Today we chose medication to manage what's going on. The challenge in this situation is that while there's some medication that we would have wanted to use, there are some challenges that this pet owner has, being alone and having some difficulty in administering medicine, let alone that the cat is quite an energetic cat, as we saw in the video. But we've had an alternative. If somebody can't use the medicated drops that we prescribe, we have to figure out how can we help. And so today we used a medication that reduces inflammation in the form of an injection. We also gave the first dose of what we would have sent home to at least get the topical medication on the eyes and in the nostrils to see if we get some benefit. Again, we're using medication in this situation as a test, asking the question, did it improve matters? And in a few days, they'll know, and I've instructed them to give me a call with that degree of improvement.
Thank you for tuning in to our second episode of Vet's Eye View. If you have any questions, please leave them in the comments below and we'll be sure to answer them. So hold on to your leashes and we'll see you next time.